You may have heard the names of these medications like Ozempic or Wegovy. They belong to a class of drugs known as GLP-1 receptor agonists. These medications have recently gained a lot of attention because they are indeed effective in weight loss. But is that the only issue? There are other important matters to consider before using these drugs. So, it's better to take a scientific and precise look at these medications and see how exactly do they work. How effective are they? What are their potential side effects? And most importantly, who should really use these medications? Should everyone who is overweight turn to these drugs? Or should this decision be made with more careful consideration and examination? What individuals should generally avoid using these medications? Let's first take a look at the names and differences between the various brands of these medications. Medications like Ozempic and Wegovy are both actually based on an active compound called semaglutide. The main difference between them is the dosage and treatment purpose. Ozempic is designed for blood sugar control in type 2 diabetes and has a lower dose. Wegovy is intended for weight loss and has a higher dose. In fact, they are essentially the same medication but with different applications. Semaglutide is one of the members of a group of drugs known as GLP-1 receptor agonists. This group includes several other medications, but semaglutide is one of the most well-known. The mechanism of these drugs is interesting. They attach to specific receptors in the body, just like a natural hormone in the body called GLP-1, and by doing so, they help regulate the body to better control blood sugar, increase feelings of fullness, and consequently lead to weight loss. What role does natural GLP-1 play in the body? You might find it interesting to know that our body produces a hormone called GLP-1, which stands for glucagon-like peptide 1. This hormone is naturally secreted in response to food intake and helps regulate blood sugar and control appetite. Medications known as GLP-1 receptor agonists are essentially designed to mimic this natural hormone in the body and enhance its function. GLP-1 is primarily produced by L cells in the intestine, but some parts of the brainstem also play a role in its production. Specifically, when food enters the digestive system, this hormone is activated and initiates specific processes in the body. The relationship between GLP-1, insulin, glucagon, and blood sugar. One of the key effects of GLP-1 is on the pancreas, the gland located just behind the stomach that secretes two vital hormones, insulin and glucagon. Insulin lowers blood sugar levels and helps cells absorb glucose. Glucagon has the opposite effect. It signals the liver to release stored glucose into the bloodstream, especially when the body has been without food for a while. GLP-1 plays an important role in this process. It increases insulin secretion while inhibiting glucagon secretion. As a result, blood glucose levels are better controlled after eating, preventing them from rising excessively. GLP-1 affects more than just blood sugar. In addition to its effects on the pancreas, GLP-1 also impacts the stomach and brain. It causes food to remain in the stomach longer, meaning it slows gastric emptying. The result is a greater and longer-lasting feeling of fullness. It also affects the hunger control centers in the brain, leading to reduced appetite. How do GLP-1 similar medications work? Now that we understand the function of the natural GLP-1 hormone, we can better grasp the purpose of GLP-1 receptor agonist medications. These medications are designed to keep blood sugar levels low, reduce feelings of hunger, slow down gastric emptying. However, the interesting point is that these medications are not just imitators, they enhance the power of natural GLP-1. Why do we need this enhancement? Because the natural GLP-1 produced by our body disappears very quickly. Its lifespan in the bloodstream is only about 1 to 2 minutes. Therefore, pharmaceutical companies have developed medications that remain active in the body for a longer duration. This characteristic makes the beneficial effects of GLP-1 more stable and effective. The half-life of the medication semaglutide is about 1 week. This means that if we compare it to a natural hormone that only lasts 1 to 2 minutes in the body, we have a medication that remains active in the blood for up to 7 days, which is a significant change. This characteristic makes the effects of the medication, such as lowering blood sugar, slowing gastric emptying, and reducing appetite, more stable and stronger. With this explanation, we can understand why medications like semaglutide, from the class of GLP-1 receptor agonists, are used to treat type 2 diabetes. In fact, Ozempic, the brand name for semaglutide, was initially designed and approved for this purpose. Since patients with type 2 diabetes often experience high blood sugar levels, this medication helps lower their blood glucose. However, during the use of this medication, doctors and researchers noticed that many patients also experienced weight loss. For this reason, semaglutide was released in higher doses under the brand name Wegovy and was officially approved by the U.S. Food and Drug Administration for weight loss. Currently, newer medications from the same GLP-1 family are being developed for weight loss, and many pharmaceutical companies are researching advanced versions of these drugs. Other benefits: reducing the risk of cardiovascular diseases. Recent research has shown that some GLP-1 receptor agonist medications, in addition to controlling blood sugar and aiding weight loss, may reduce the risk of cardiovascular issues, such as stroke or heart attack, in individuals with a history of heart disease. It is still not exactly clear where this protective effect comes from, but several hypotheses have been proposed. Perhaps lowering blood sugar plays a role, or it might be that a reduction in body fat, adipose tissue, decreases heart risk. It could even be a combination of these two factors. Additionally, some studies have indicated that these medications may also reduce inflammation in blood vessels, which is itself a significant factor in heart disease. In any case, there is evidence suggesting that these medications can provide additional benefits for individuals who already have heart problems. Possible side effects: gastrointestinal issues, fatigue, and others. These medications, initially developed for diabetes treatment, can lead to significant weight loss, up to about 15% of body weight. Additionally, some research has shown that they may also have cardiovascular health benefits. However, the question arises, if they are so beneficial, why doesn't everyone looking to lose weight use them? The answer is that every medication comes with its own financial costs and specific side effects. The costs of these medications are typically high, and they may also have associated side effects. Among the most common side effects of these medications are gastrointestinal issues, particularly nausea. Other common side effects include vomiting, diarrhea or constipation, bloating, and abdominal pain, often resulting from slowed food movement in the stomach. Typically, treatment starts with a low dose of the medication, which is gradually increased to allow the body to adjust. In many cases, these side effects diminish over time, but some individuals may continue to experience them. Users also sometimes report fatigue and headaches, and in rare cases, more serious side effects may occur. More serious side effects: pancreatitis, gallbladder issues, and others. Although more severe side effects are less commonly observed, they should not be overlooked. Pancreatitis is one potential side effect that is not yet fully understood but may occur due to excessive stimulation of the pancreas by the medication. This can lead to blockage of pancreatic ducts, fluid accumulation, and inflammation. Gallbladder problems are also a concern. There may be a link between the use of these medications and the formation of gallstones, likely due to rapid weight loss or decreased gallbladder emptying. Early research raised concerns about a potential increased risk of thyroid cancer, but these findings were mainly observed in animal studies and have not yet been proven in humans. Finally, less serious side effects, which still matter, especially in older individuals, should be taken into consideration. Muscle loss, an important and serious issue. One important point to consider is that significant weight loss from these medications is not solely due to fat loss. A portion of the lost weight may come from muscle loss, which can also lead to decreased physical strength. Financial costs, the difference between brand name and compounded medications. Now, let's talk about costs. Medications like Ozempic and Wegovy are expensive, and without insurance, their cost can exceed $1,000 per month. One reason for this high price is the high demand for these medications, and brand-name drugs are always more expensive. Some individuals turn to compounded pharmacies to reduce costs, seeking similar doses of semaglutide. However, one must be very cautious, especially with online compounded pharmacies. Some of these pharmacies are reliable, but others may lack the necessary quality and credibility and can sometimes cause issues. Therefore, anyone considering this option should conduct thorough research. Who should use GLP-1 receptor agonists for weight loss and who should avoid them? Here, we are talking about the use of these medications for weight loss. Since the early 2000s, these drugs have been recognized as an effective option for managing type 2 diabetes. Of course, type 2 diabetes can also be improved through diet and exercise. However, the interesting point about using these medications for weight loss is that medical studies almost universally indicate that these drugs should be used alongside diet and exercise. This means that if you are going to use these medications, you must also change your lifestyle simultaneously. Of course, we must acknowledge that some individuals do not achieve results with diet and exercise alone. Some struggle to stick to their plans, while others genuinely try but find it difficult to lose weight due to genetic factors, injuries, or other health issues. In such cases, one might consider using GLP-1 receptor agonists, as we need to weigh the benefits of reducing long-term health risks associated with being overweight against the potential risks of short-term and long-term side effects of the medication. If the health risks of remaining overweight outweigh the risks of the medication, then using the drug may be a suitable option. Nutritional considerations and the importance of strength training. When individuals take these medications, they often experience a reduction in food intake without making significant changes to their diet. This is due to appetite suppression and slower gastric emptying. However, it is important that the food they consume comes from quality and nutritious sources, with particular attention to protein intake. One thing that should not be overlooked is the importance of strength training. As I mentioned earlier, part of the weight loss may come from muscle loss. To mitigate this issue, it is essential to have adequate protein in the diet and to engage in resistance training to stimulate the muscles and preserve them as much as possible. This is crucial because if only medication is taken without exercise, weight will decrease, but a significant portion of that loss will be muscle, which is particularly important for older individuals. The risk of weight regain after stopping medication. One of the most important issues to consider is that if you stop taking the medication, the majority of people will regain the weight they lost. Of course, if you have also changed your diet and exercise habits at the same time as starting the medication and continue to do so, you may be able to maintain some of the lost weight. However, most of the weight lost due to the medication typically comes back. So, if you are one of those people who want to lose those last few pounds, I might challenge you a bit and ask, is it really worth it? Are you willing to accept the side effects? Are you prepared to bear the financial costs? And are you ready to take the medication permanently? Or perhaps you can still lose those last few pounds without medication by making further adjustments to your diet and exercise program. My guess is that if those few pounds truly matter to you, you will likely find a way to achieve it without medication, but ultimately the decision is yours. Make sure to discuss this matter with your doctor or healthcare provider before making any final decisions. I hope the information I shared with you today in this video helps you make a better decision.